Hello everyone, my name is Dr. Patel. I am an instructor at Param Institute of Education, and today I'm talking about Certified Electrocardiography Technician Program. We call it ECG or EKG Technician Program. Today we'll discuss about the program in detail, and I am an instructor teaching ECG or EKG Tech program at Param Institute of Education. So let's start and explore the program. Let's go to the next slide. Introduction. Okay, this is a very short program. It's a 70 clock hour, and this program provides an entry level job training or job position training for an EKG technician, or we also call it EKG monitoring technician. Certification. Before I go to the certification, let me discuss about the hours and the timing. Since I earlier said that it's a 70-hour program, it will approximately take 4 weeks or 1 month to complete, and a student has to approximately give 4 hours of in a day for 4 days in a week from Monday to Thursday. So it's a 4 week program, pretty short program, and in that 4 week you can able to achieve that certification. So now let's talk about certification. So after successfully completion of the course, the student will be able to take an exam for certification as a certified electrocardiography technician by National Health Career Association. Now, National Health Career Association, also known as NHA, it's a third-party organization, a private organization, which provides credentials to those students who have successfully completed ECG Tech training or formal education. Course syllabus. The first half of the class will cover the basic concept of cardiovascular system, including anatomy, physiology, essential skills needed to operate the equipment and perform an EKG, and advanced EKG performing skills, including Holter, event monitoring, stress EKG, interpretation, and clinical significance. The second half includes clinical lab experience within the institute to acquire the clinical hands-on training and employability skills. The reason why we divide that the whole program into two, it's not a formal division, but it's just within the program will separate the theoretical aspect with the practical or the lab aspect. So in theoretical aspect, we'll talk more about the heart, its structure, the function, the machine, the EKG machine, the operation, the performance, attachment, as well as the other equipments related to cardiology. Now, cardiology is a branch of medicine where dealing with the heart patient or heart anatomy and physiology. So in two halves, we will pretty much covers the entire subject, EKG and related, chapters. Now, since I talk about the chapter, let's talk about the major subjects taught. Uh, so in classroom instruction, as I earlier said that the classroom instruction will include various topics, the main topics, the major topics, and that includes the first one is like role of electrocardiograph or electrocardiographer. Two, the anatomy and physiology of the cardiovascular system. Three, electrocardiograph. Now the graph is the machine. So the graph word is a medical term used for the machine. So in other terms, electrocardiography is an EKG machine. So we'll learn about the machine. Four, maintenance and troubleshooting of the equipment. What you will do in case of troubleshooting? What if the machine is not working properly? Whom should you approach? How do you deal with the day-to-day wear and tear or other problems related to the machine? How would you change the paper? How would you maintain the equipment? So that is very important. Five, EKG interpretation. In interpretation, you will learn how to interpret the EKG findings in various patients. Six, the laws and ethics related to the medical practice, especially in cardiology. What are the laws and ethics comes into your way will protect you or prevent you from doing certain unnecessary things. 7. Medical terminology. Now, medical terminology is the medical language. Here you'll specifically learn terminologies related to cardiovascular system or heart system. 8. Vital signs. Vital signs are your blood pressure, pulse, respiration, temperature that you're going to perform on patient, and we will teach you a little bit about vital signs. 9. CPR. CPR stands for cardiopulmonary resuscitation. Again, CPR is a first aid or first line a measure that need to be taken when patient is unconscious or is thought to be dead. So it's a life-saving measure. 10. Special procedures like stress EKG or ambulatory EKGs. Now, stress EKGs and ambulatory EKGs are specialized EKGs that is normally used to diagnose certain heart conditions. Purpose of EKG labs. Now, why do you do practicals? As I earlier said in my second or third slide about the divisions of the labs. I mean, divisions of the whole program. The first half is a theory aspect. The second half is a lab aspect. Why the labs are necessary? So the student acquire the real world experience in patient care, and they can also improve their competencies by hands-on experience with on-the-job training. So in order to learn what you have learned theoretically, in order to perform that practically on patient, you need to have a lab experience. It's very important. If you don't know how to perform it, there's no point of learning theoretically at the first place. That's very important to have hands-on experience. Second, this is the opportunity to get employed after graduation in hospital, doctor's offices, or in urgent care centers. There are various job opportunities for EKG techs. You can able to work at the hospital. You can choose to work at the doctor's office, or there are urgent care centers. They also hire EKG techs. And the third and the most important advantage is that you can able to pursue a higher education. For example, cardiovascular tech. You can become a cardiovascular tech. Cardiovascular tech is a little higher education. Completion after EKG tech, you can able to achieve cardiovascular tech while going to for further education. Now, it's a high paid job, so it's a career ladder. You can advance your career by choosing this particular education. There are more options available. At the entry level or at the base level, there's an EKG or ECG technician program, which we are discussing, the 70-hour program, what we are offering. What we are not offering are the program which are technical level programs, which you can get the education from a community college or from a university. And that technical level, there are two programs. One is a cardiovascular tech, and second is a cardiovascular technologist. Now, cardiovascular technician or technologist, that's the next level, right? If you still want to make your career go higher, you can choose even a higher level or professional level programs. And here are the examples. The first one is a cardiovascular radiology technicians, where you going to take certain images of patient's heart or heart related condition, which will help them actually to diagnose or to assess the treatment or to help in treatment. That computerized tomography technician, it's more like a CT scan. And this is a particularly related to heart. So you're basically taking a CT scan of the chest area and mainly focusing on the heart. Cardiac catheterization lab technologist, CCLT. Now, cardiac catheterization lab technologist is someone who works in a cardiac cath lab where they perform angiography or angioplasty. They are the vascular procedures normally done to diagnose or treat the heart attack patients or patients who are suffering from or have suffered from heart attack. So again, it's a very specialized field and it's a higher scope of salary and job satisfaction. And the last one is called cardiovascular invasive specialist. Now, again, invasive specialist, you can able to work with the surgeon, cardiothoracic surgeon, help them to perform various invasive procedures. Excuse me. Next slide. Is the EKG Tech programs a day or evening program? Very good question. Well, currently, what we offer here is a day program. And the normal classroom hours are 9 a.m. to 1:30 p.m. There'll be half an hour break. So approximately you spend 4 hours in a day. And evening classes will be available in future, and we'll notify you through our website and through our flyers. So right now what we are offering is a daytime program. Next, why one should get trained in a recognized institute? Why you choose us? Why Param? Why not any other institute? Well, an EKG Tech certification program offered by a recognized institute prepares the student with the practical skills and a necessary medical knowledge needed to work in the field. Excuse me. Certificate programs provides participants with a foundation in heart anatomy, physiology, and cardiac diseases. Students will learn how to communicate patients on a medical treatment. They can connect patient to EKG machines, and they can also monitor them during the therapy time. While it may also prepare students for professional certification exam, like I earlier said, NHA, National Health Career Association. It's very important to be certified or to get certification, which will not only prove your competencies, but it will also help in your career advancement. You can able to get jobs easily or faster with the certification compared to those who have no certification. Now, what is an enrollment process with us? It's pretty easy. Well, in order to register for EKG Tech program, one should contact our admission office and communicate with an admission rep or admission representative. You come to us, talk to a rep, and he'll explain you from A to Z about the program and the whole process. Well, the admission rep at PI means Para Ministry of Education. An admission rep at PI will guide you through the whole process, and then they'll also assist you to fulfill your requirement. I mean, they are here, they are trained and experienced to answer and satisfy your questions and your queries. So please feel free to visit us, ask questions. I mean, you can call us, visit us. Please let us know what are your queries and why you want to join the program. So we always welcome the questions. And here is our address. How do you contact us? We are Promised of Education, and we are located at 200 Middlesex Essex Turnpike, Suite 105. We are very close to Metro Park train station in Islin, New Jersey. Our zip code is 08830. Our office phone numbers, there are two numbers you can call, 732-283-5656, or you may also call 732-283-7222. Email, you can please, if you would like to email us about your suggestions, your questions, queries, we are ready to accept it. We are ready to read them. We are ready to answer them and respond them. So please email us at info@paramedu.com. Here is the whole complete presentation. If you have any other queries which I have not mentioned here or which I have not discussed, please feel free to call us and let us know what are your queries. All right. Well, thanks and have a nice day and nice weekend.